Okay, good morning, everyone. Thank you so much for joining the STAG Foundation's second virtual Doc Talk session today. My name is Cindy, and I'm part of the foundation team here at STAG. I just want to go over a few quick housekeeping points before we begin this morning. In order to ensure that all participants have an enjoyable experience, we're going to mute everyone for the duration of the presentation. If you have questions that come up that you'd like to ask during our Q&A session at the end, please type them in the chat box, which is located on the bottom right of your screen. And our presenters will answer as many questions as they can in the allotted time at the end of today's session. Also, just a reminder, this session is being recorded and will be shared through the Foundation's website and social media next week. As always, we would love to hear your thoughts about today's presentation, so please feel free to send your comments by emailing foundation@stag.on.ca. Now, without further ado, I'd like to introduce Foundation Board Director Julie Cassidy. Thanks, Julie.
Good morning, everyone. And on behalf of the STAGS Foundation Board of Directors and staff, welcome, and thank you for joining us for our September Doc Talk. This morning, it is my pleasure to introduce STAG's Diagnostic Imaging Department Chief, Dr. Walter Romano, and Department Manager, Yolanda Mundt. Dr. Walter Romano is a graduate of Western University's Medical School and Diagnostic Imaging program. He has subspecialty training in cross-sectional imaging with certification in maternal fetal medicine from the University of Michigan. Dr. Romano was a member of Western's Department of Diagnostic Imaging until 2013, when he joined the St. Thomas Elgin General Hospital as Department Chief. Yolanda Mundt is a graduate of Fanshawe College, pre-health science, medical radiation technology, and ultrasound technologist. She has held positions with Fanshaw's Mammography Training Program, St. Joseph's Healthcare London, Strathroy Middlesex Health Alliance, and GE Medical. Today, Dr. Romano and Yolanda are going to share their insights into the past, the present, and the future of digital imaging. They will highlight how, through foundation support, diagnostic imaging has transformed with current technologies since 2014, including patient care and technological impacts, as well as program enhancements. Dr. Romano and Yolanda, welcome.
Thank you, everyone, for joining us. I've been at STAG for 4 years, and I came to STAG because I saw an opportunity that I would like to use. Saw a lot of work with the help of new equipment, program enhancement.
Sorry, Yolanda.
Yeah.
Sorry, we can't quite hear you.
Maybe because of my mask. Now, if I'm in front, is this better?
That's perfect.
Okay. Sorry, I'll start again. So thank you for joining us. Thank you for joining us this morning. I've been at STAG for 4 years. I came to STAG because I saw an opportunity that I might be able to create some change. I saw a lot of raw talent that existed, and with the help of new equipment and program enhancements, we could become a facility that would rival our neighbors in London. Part of the reason I came was because of Dr. Romano, who I met in the late 80s as I was a student in training, and Dr. Romano was a resident in radiology. We worked together for 26 years, and I had the privilege of watching him transform an organization and their programs into pillar programs, watched his style of leadership that inspired us all, and one that has not been reproduced in the DI world since his departure. Walt joined St. Thomas in 2013, and when the management position opened in 2014, he tapped me on the shoulder to explore this opportunity, and I've never regretted my decision to come here. I'm going to talk to you today about our journey over the last few years with a significant support from our foundation department, as without this support, our improvements would not exist. Our foundation has played a significant role in helping us to replace our equipment, fund renovations, which has all given us the pathway to evolve. Purchasing equipment isn't just about going out and buying a new device. It's about what can we get that will enhance our programs, that will allow us to make our services better for our Elgin County patients. New equipment means recruitment, physicians and staff of significant caliber. I'll let Dr. Romano speak to that impact as well. In this talk, we will show you what we've done over the past few years and where that has brought us to today and where we are going.
Thanks, Yolanda. Yolanda is very generous in her comments, but in reality, like any good chief, Yolanda is really the one who's made the things happen in our department. And it's, she's mentioned it, but it's clear that none of this would have happened without the foundation's support to bring this together. Radiology, unfortunately, while it's very exciting, a lot of the tools we have are things that are published in Scientific American and other things, and it certainly gets a lot of press. They are very expensive pieces of equipment and require significant support from the community and the foundation to make happen.
Hi, sorry to interrupt again. We can't hear you.
So just showing you the replacements that have occurred. In 2016, we replaced our CT scanner, our mammography unit. We had to do renovations in 2018 to allow growth and the second mammography unit. We bought a point of care device, which facilitates our breast biopsies, which allows us to keep the care in the room, and we can even go up to the operating room to help the surgeons. We replaced a fluoro unit in 2018, a general upright unit, 3 mobile units, which was important because when COVID hit, we had to do a lot of portable x-rays in Emerge and on the floor, and our aging units would not have survived that. We just received our new nuclear medicine camera. We have 2 cameras here, so the first one has been replaced. And upcoming replacements that we have our ultrasound department. We have 4 core units that will have to be replaced. That has been sidelined. We need to do some renovations due to COVID, so things will be back on track next year. Our nuclear medicine still requires our second camera to be replaced, which is going to be a hybrid of a gamma camera and a SPECT CT. That will also require renovations. And we have 2 general units that will be replaced and a BMD. So with new equipment means new programs, and we've opened the door to many improvements. We recently became a breast assessment program in the fall of 2019. And becoming a breast assessment center really means just improving our care and access to our patients. So many of our patients do not have to go to London to seek this care. We are one of the first rural sites to have a seed program for patients that require breast localization. We recently became accredited for our B&B unit. We do organ biopsies, we do joint injections, we've become a stroke program. We have a cardiac program for cardiac imaging. And this increases our ability to identify abnormalities leading to early diagnosis of cancer, identify stroke risk, and other life-threatening conditions that save lives. So just showing you this is just a fancy graph showing you basically in 2016, when you look at the bottom here, this is when our new CT scanner was installed. And if you don't look at the right-hand side of the graph, we were pretty much, other than the blue line is the emergency services. And although those patients were increasing, but our inpatients stayed relatively the same, and our outpatients, because we could only perform so much. Once the new unit was installed, you will see the graph just exponentially growing in every aspect. Because of the new CT scanner, it was more efficient, allowed us to have more throughput, and because the biggest thing is wait time, so we're always cognizant of getting patients in. Just another graph showing you about the impact this new CT scanner allowed our emergency department to better serve our patients. We didn't have to send our patients out to other facilities to image them. So that has increased the need for the CT scanner, and you'll see it responding that as many as patients come in through Emerge, our CT volumes are going up because it has become a tool in diagnosis. I always like to use this slide. I come from the world of cameras. If you think of back in the day when you had the old cameras, you know, you'd produce a picture, but now with the SLR cameras, but I have things that Walt does like to, he likes cars. So I'll let him speak to the efficiency that brings.
Yolanda's nicely demonstrated what the CT scanner did for us in terms of volumes. This diagram sort of nicely depicts, you know, what we all recognize for all of us who have laptops, for all of us who drive cars or do photography. The new technology is more efficient and definitely faster. I should point out that not only are we doing greater volumes in CT because of how rapid our scanner will scan patients, but the technological advances Yolanda and I are going to show you in a couple of minutes allow us to get actually very exciting imaging that wasn't available to us even just a couple of years ago. So in imaging, there's a whole speed component and there's a whole imaging quality component that's been elevated in the last few years here in St. Thomas.
The new Siemens CT that was installed. Okay. And this is just showing you
Hi, sorry, Yolanda, we can't hear you again.
Sorry, Yolanda was just talking about, that was our scanner you just saw, the new scanner. And these are some of the images that our scanner can generate. So we talk about speed. Speed is very important because it allows us to capture images almost in still frame. The image on your right is actually a heart that's been reconstructed from a CT scan. And again, because of the speed of the scanner and the software, you actually can generate almost a still image of a beating structure. And the image on your left is a picture of somebody's chest. And you can see as we scroll through this image, the heart, the pulmonary vessels, the lungs, all showing almost like nothing's moving, yet the patient in these cases is actually breathing through the exam. So very exciting technology, allows us to detect disease we never even thought about detecting just several years ago. And again, just another example, we showed you chest and heart. We can do the same thing with bones. The images on your left are a CT of a shoulder, and you can appreciate that we can reconstruct these images both in 3D and in 2D to show surgeons the extent of the fracture so that mapping can be done before people go to the OR. These are all things that, again, several years ago were not possible. I should also mention, and I think this is something I overlooked at the start, not only is our scanner faster and more efficient, the doses of radiation we supply to the patient are significantly reduced. In many cases, the radiation dose from a CT chest is 80% less than it was just 5 years ago. So we're not only getting better imaging, but we're also providing a less risky environment for our patients who require multiple scans. And then just another image of what we do now in the stroke program. This is a picture, an angiogram done on CT of somebody's head and neck. You can see the vessels in the brain, you can see the vessels in the neck, and you can appreciate on this angiogram where the arrow is, there's actually an occlusion of the common carotid artery on the left side of the patient. And again, this is all available to us. Actually, this image could be generated in about 15 to 18 seconds. So that's how quick the scanner is in terms of generating this kind of data for us.
So in 2019, we became a breast assessment program, and the installation of our first unit in 2016 was the beginning of our transformation. Why is it important to be a breast assessment center? First of all, it's around timeliness, around what happens after that patient's first screening, that we can get patients to that final answer quicker. We introduced the ability to do stereotactic procedures in 2017. Prior to that, patients had to go to London for that. And again, the purchase of the point of care device, the CubTech, and it changed our pathways to improve our patient experience. The introduction of the radiation seeds, we were the first rural site, and also just bridging pathways to our general surgery group. That was very important. And then our new space opened in February of 2019. So, and again, 2019, we became the official assessment center. And that's just showing you an image of our unit. And this is the CubTech device. This is Sally Vergeer, who is our chief mammography technologist. And this is just a picture showing you the size of that little radioactive seed that is used as a marking device for patients that have to go to the OR to have an abnormality removed. So believe it or not, when I started my career, we were just finishing doing mammography in this format, that we actually just placed a breast on a table. This is our new suite, and it's called a sensory suite, because it's a very stressful type of exam. So by having just a movie screen that's just having scenery, beautiful pictures of waterfalls and mountains, it just really helps the patient relax, because that is very important. And now, when you look at, yes, in 1969, we were doing mammography, but if you see, the images has changed significantly over time. And in 2019, we were able to purchase contrast mammography that just was put onto the device itself. And what it allows us to do is to give a patient contrast, and actually it detects a cancer that would be buried in this breast tissue. So just a tool that we can now use. So I always love these pictures, because here it is, likely Sally, you can't even tell, who that is, even if this was your picture of your family. And if you blew that image up, you still can't see. So how technology has evolved imaging, I compare it to this field of sunflowers. So it's not about the whole field of sunflowers, and it's not even about the sunflower. It's about these bees that are on the sunflowers. And that's how much the detail has changed for us over time. So with the addition of contrast enhanced mammography, it has truly transformed our patients with dense tissue. That has always been a barrier for us. So London is the only site that has contrast in this area other than St. Thomas. So it's used as a problem-solving tool, and it also does replace the need for MRI with some patients.
So this is very exciting for us as radiologists. This is a typical case that we would have seen with very, very dense breast tissue, the white tissue. And unfortunately, because of the density of that tissue, our x-rays can't penetrate that, and we lose a lot of detail. So we don't know what lies in the midst of that dense tissue. And we know that women with dense breast tissue have a higher risk of malignancy. So what can we do? Well, that's what Yolanda was just talking about. Here's a contrast mammogram on that patient. And you can appreciate on this image that normal breast tissue does have a low level of enhancement, and we subtract out the images. But you can appreciate that once you subtract out the images, there is an area of enhancement here, this small nodule in the breast that was not visible on the regular screening mammogram. This gives us, the radiologists, a chance now to focus in on this area, examine it with ultrasound, and in this case, biopsy it and discover a small breast cancer that probably would have been another 2 to 5 years before we would have recognized it as pathology. And this is just a couple more examples of what contrast mammography does for us. Here, a mammogram. Again, you can appreciate that the glandular tissue is the white tissue in the breast. And, is this something here in the left breast? Is it a little bit denser? Is it a little bit asymmetric? Possibly. But again, as a radiologist, we're not sure. We do a contrast mammogram, and you can appreciate that not only is that area in question, there are several other areas in the breast that require attention. So this is a case where we discover not just one breast cancer in this patient, but several, and that diagnosis will change this woman's outcome and her life. Just another example. You can tell I'm excited about this, why I'm showing so many examples of this technology. And again, in a community hospital, there is no one else in Southwestern Ontario. In fact, I don't think in Ontario that has contrast mammography. Only the major breast imaging centers like London have it. So we're really lucky, and it is a modality that we think is going to change the way we do mammography. So again, just another example of a subtle area of enhancement in a breast that was not appreciated on the mammogram that turns out to be a very early breast cancer. And again, another example, very dense breast, very challenging to examine. We do contrast, and clearly this poor woman has a very large cancer in her breast, which really was not visible on the routine mammograms. We believe that it probably is as good in many cases as MRI. And this is MR in that patient showing the enhancing breast lesion, but we feel that we can essentially parallel the advantages that MRI would have, which is really only available at several large breast imaging centers in Ontario.
So with our nuclear medicine department, we recently were able to install a brand new gamma camera, and that has given us some more significant improvements. The camera that we had was 20 years old. So that's a picture just showing you what the old camera looked like, and even the area itself, it was sort of dark, and it was a very ominous looking machine. So with the companies, they've all made enhancements, because that's always a main factor in making patients comfortable. This is our new unit, and just when you look at just the design, it's much more streamlined. We were able to, with the help of renovations and for Foundation's help, enhance the room and to make it a little bit brighter and much more appealing. This device has significantly allowed us to improve our turnaround times. Nuclear medicine scans do take longer, they're not as quick, and on our previous unit also required more dose. So with this new unit, we've been able to reduce dose, increase our patient appointment times in a day so we can get more patients through in a timely fashion.
So I'm not a nuclear medicine physician, but on the topic of being able to recruit, one of the things the foundation has done for us is by providing funds so that we can purchase some of this state-of-the-art equipment that we've just shown you, including our new scanner in nuclear medicine. We're able to recruit some of the best and brightest radiologists to a practice. So in the last 3 years, we've recruited 3 young radiologists, all with subspecialty training, including a radiologist, Dr. Barfitt, who has nuclear medicine certification along with radiology, so a dual certified radiologist, very unique. In reality, there's really the only time you find dual certified radiologists is typically in teaching centers. So we're very lucky to have Joe with us, who can really take advantage of our nuclear medicine practice. And here is a MIBI scan showing radio tracer activity that's demonstrated as orange on the images that's taken up by the heart muscle. And then we're able to stress patients and then image them afterwards, looking for areas where the activity diminishes. So actual areas of ischemia in the heart that require more evaluation. We can also look at the lungs with nuclear medicine. We can appreciate here that somebody with pulmonary emboli, the normal lungs take up the radio tracer uniformly. In people with emboli, pulmonary embolic disease, you can see these black areas where the blood flow is not normal. Another quick and easy way to determine pulmonary embolus outside of CT scanning in patients who can't tolerate the IV contrast. Another use that we do in nuclear medicine, a very critical part of breast care, is identifying sentinel lymph nodes in women with known breast cancer. We can inject radiotracer in the woman's breast in the area around the lesion or the nipple, and then we can watch that radiotracer migrate to the draining lymph nodes that allow a surgeon to then resect those nodes in staging the woman's breast cancer. A much more efficient way than just essentially doing a radical node dissection that requires all the lymph nodes in the axilla to be taken out. There, I'm just a picture showing the radiotracer activity after the injection around the nipple, and you can see the sentinel lymph nodes as small dots outside where the injection site was, and it allows the surgeon to direct his dissection to those areas. Again, prostate cancer is also something that unfortunately occurs regularly in our community. This is an example of what bone scans will do for us in terms of staging people with metastatic bone disease in an ability to outline the number of lesions that are present in bone, and allows us to monitor the patient's therapy when they get agents that may treat these bone metastases. And of course, thyroid scans, where we look for activity in a thyroid that tells us that there may be a malignancy in that thyroid gland, and lets us direct our biopsies to that area in the thyroid. These are all important things that allow us to provide dedicated cancer care treatment and diagnosis here in St. Thomas. One of the good uses of this modality is when we have, and I'm sure many of you can speak to this, where you've had an injury. In this case, the person twisted their ankle, was having significant pain, but the x-rays look normal. We can't see a fracture on the x-rays, but the patient is really uncomfortable. We can actually do a CT scan and overlay that with a bone scan. And in reality, this red area here on this image shows that there actually is a fracture related to the ankle that wasn't visible on radiographs, that allows the orthopedic surgeon to modify the care for this patient. And again, just that picture in the sagittal view showing that activity in the scalar joint, so this patient actually does have an occult fracture. MRI. There is a big question mark there. Yolanda and I talk about this regularly, and as foundation members, I'm sure you're aware of this push by our hospital to look at MR. Like, I would be amiss as the chief of radiology if I didn't ask for more support and more equipment. And I think from my perspective, our sights are set next on MRI for our department. It's really a tool we need in this community. I think many of you know that with the stroke program and all the clinical services that we support, MR has really become integral to that patient care model. And it'll be something I think you're going to hear a lot more about over the next, I hope, 12 to 18 months as we try to ramp up our pitch to get an MR here in our department here in St. Thomas.
So this is the end of our talk, but just to highlight all the great things, and again, without the support of our foundation, and you know, there's nothing better than when you work at a facility that gives you the tools that you need to do your work. It allows creativity to flow. We have pride. You know, our staff love to work here because they know they're working on equipment that is high caliber and that they're making a difference for their patients. Our goal is program development that leads into legacy programs. Because it's not about, that while we're here, but it's when we're not here. We need this to carry on. We want this momentum to continue because we do want to be leaders in the medical imaging. Our staff engagement, we have people now, when I first arrived here, it was actually very challenging to put up a posting and try to fill it. And on average, I put out a posting and we have between 20 or 30 people for that one posting. Our physician and staff recruitment has had a significant impact with the caliber of physicians that Dr. Romano spoke of. But in the end, who does it benefit is our Elgin County patients. So thank you very much. And if you have any questions.
Thank you very much. That was fascinating. We do have one question. Can you speak at all to where we stand with respect to being approved for an MRI?
I think that's a little bit. I think it's probably better addressed to Mr. Biron and the administrative staff. We have put a request into the ministry for an MR for our site. My understanding is that they are aware of our request, that we have essentially dotted the I's and crossed the T's on why St. Thomas Elgin needs an MR. But I think, given the politics right now, COVID and other things, it's on hold. Our hope is that we believe the province is going to approve several MRs. We hope in the next 12 to 18 months. So not just our site, but there's a few sites in the province that are requesting MR, and we hope that would be part of that approval of 4 or 5 MRs they may approve for the province. Certainly, we've worked with the administration to provide the ministry with all the insights in terms of our volumes. It's interesting. Yolanda and I did plot volumes. Over 5,000 patients in 2018 went outside of Elgin County for MRR. And so is there a need in this community? Yes, there is. Do we have the clinical support teams here at the hospital for an MR? Yes, we do. It's really just a matter of getting that approval. We actually even have the space.
Wonderful. Thank you for that. I don't see any more questions at this time. Remind everybody, please feel free if you think of a question afterwards, email the foundation and we will pass on your questions and share them with the community. So thank you so much. I'm going to pass it back over to Julie for some closing remarks.
Dr. Romano and Yolanda, thank you for sharing your knowledge and expertise with us this morning. Your presentation exceeded expectations, and I'm sure our participants found your doc talk very informative. There have been many changes to the diagnostic imaging department, as we could see from your presentation, and we thank you for your enthusiasm and your patience to best serve the patients at STEG with current technology. Doc Talks is a series of presentations that the Foundation will be hosting bi-monthly. Please watch for future announcements as we confirm our schedule. And if you have any program suggestions for topics of interest to you or your family, please let us know. The Foundation is able to support these significant changes and improvements to care at our hospital because of the generosity of our donors. So at this time, I'll just say enjoy this beautiful day.
Thanks, everyone.
Thank you.